Attention deficit hyperactivity disorder is a neurological processing disorder which is typically first identified and diagnosed in school-age children. Adults may also be diagnosed with ADHD, although clinically significant symptoms must be present before age 7 years to meet the DSM-5 diagnostic criteria. Approximately 5% of school-age children and about 2.5% of adults have ADHD. Recent research supports the genetic inheritance of ADHD in families, leading scientists to look to heredity as the most important contributing etiological factor in the development of ADHD. ADHD is an often misunderstood disorder. The disorder's name implies attention deficiencies, but in reality, the disorder involves attention irregularities. While people with ADHD may struggle to attend some tasks for a period of time, they also possess a unique ability to hyperfocus or focus exceptionally attentively to tasks that interest them. Clients with ADHD may exhibit hyperactive behavior, may be largely inattentive, or may present a combination of both. Children with ADHD often have trouble focusing in school and may have poor grades, and thus experience consequences secondary to negative behavior, often related to impulse control or inattentiveness. Students with ADHD may have problems with organization, fail to complete assignments, and struggle with the necessary self-regulation to stay on task during an 8-hour school day. Adults with ADHD may also experience similar symptoms with the addition of strained interpersonal relationships and difficulties at work, or more severe outcomes such as self-medication with alcohol and/or other drugs. In children, ADHD symptoms present differently by gender, with girls with ADHD being more likely to report inattentiveness and greater co-occurring anxiety and more eating issues, and being less likely to engage in disruptive and aggressive behaviors than boys with ADHD. Boys with ADHD are also more likely to have co-occurring behaviors, depressive and learning disorders, than girls with ADHD. Men are more likely to engage in acting out or hyperactive behaviors as compared to women. ADHD is the most common disorder presenting in childhood and is 2 or 3 times more often in boys than in girls. It is estimated that as much as 70% of these youth will demonstrate ADHD or ADD symptoms into their adult years. The symptoms for adults with these disorders are almost identical to the symptoms seen in children, but adults tend to display less hyperactivity and more internalized restlessness. Molecular genetics and neuroimaging studies confirm that disorders of attention, like ADHD, are heterogeneous neurobiological disorders, mainly of the dopaminergic and noradrenergic pathways. Other studies have demonstrated frontal lobe dysfunction and a dysregulation of the neurotransmitters dopamine and norepinephrine in the frontal lobes, the basal ganglia, and amygdala, and possibly the reticular formation. Functional MRI scans have shown consistent irregular neurotransmitter activity in the frontal striatal networks, and most important, in the anterior cingulate gyrus. These areas of the brain also act like filters, assisting the patient in screening out irrelevant information. In particular, the anterior cingulate acts as a decision-making discrimination system. Drugs used in the treatment of attention disorders stimulate these brain centers, allowing them to work faster and more efficiently, and helps assist the patient with both attention and retention of information. Clients with ADHD may struggle with self-esteem issues and often report feeling different from others as a result of difficulties in work, school, or home environments. Some parent tips would be to build the child's self-esteem by offering praise for completion of tasks and consistent participation in treatment, as well as by pointing out their strengths and the ways that their ADHD symptoms can serve at times as a resource. And also, figure out how to harness abilities and channel them in productive ways. Assure them that their behavior is a result of a neurological condition and that the disorder is not their fault or a strike against their character. Increase organization and planning skills by deconstructing larger assignments and projects into smaller, more manageable steps. Create an action plan, including a timeline for any anxiety-producing, overwhelming tasks. Reduce distractibility. Divide larger tasks into chunks. Use timers and alarms to aid in staying on tasks, and write down distractions as they occur instead of acting on them. Learn and practice problem-solving techniques. For example, identify the problem, brainstorm possible solutions, break down solutions into manageable steps, try the best solution, and assess the outcome. Learn and apply cognitive restructuring techniques. Identify and challenge self-critical thoughts and beliefs. For example, consider alternative thoughts and strategies for addressing problematic, irrational thoughts.